Come on, Mo. Good boy. Come on.
Welcome to Moments of Experience, a podcast inspired by my faithful best friend, Mo, a 14-year-old beagle who gave us moments of hope, compassion, and love during a time of tragic loss and life-threatening family illness. I'm your host, Geoffrey Smith, and I invite you to join me for powerful, uplifting, and sometimes even challenging conversations with some of the world's leading innovators in employee, patient, caregiver, and human experience. Together, we dive into the meaningful moments that shape us, move us, and inspire us to pursue our purpose in life. I'm glad you chose to join us as we explore the big and small moments that bring meaning to our lives and connect us to our true calling. Welcome, Denise. I'm so glad to have you here. I can't wait for this conversation. Welcome.
Same, Geoffrey. I've been looking forward to it.
Okay, so as people have listened before, know I start off the show by introducing my guest, but I don't like canned bios. I think they're boring. So I tell my guest who they are to me, how they show up to me. And I'll say Denise Wiseman is an entrepreneur, a connector, a patient experience advocate, a synergistic collaborator, and a ruckus maker that works every day to bring people together to reinvent healthcare.
Geoffrey, I couldn't have said it better. That's exactly what I'd want to say. Yeah.
Okay. Well,
I love that that's how I show up to you.
Other things you'd like to add?
When I was thinking about that, because I knew you were going to ask, I started it with, I'm a ruckus maker for change in healthcare. So yeah, exactly. And to me, it's that ruckus we need to make about turning healthcare back so that it's people focused. So that's patients and everybody within, right? It's not just patient focused, but it's everybody connected. And that it's a reduction of bureaucracy and hierarchical stuff and profit-centered instead of patient-centered. So yeah, I love that I'm showing up exactly how I'd want to show up, Geoffrey. That's great.
Great. I had a guest recently who were talking about, how the system keeps changing. And at 1 minute, we want to be physician-focused, and then 1 minute, we want to be patient-focused. And the fact is, we need to be human-focused. We need just to have everyone in mind as we figure out how to reinvent healthcare. So I start the show by telling you something I've learned from you, or something synergistic with your work that just resonates so much that I need to have you on the show. But before I do that, I want to thank you, because Denise was one of the first people I met after I left the corporate world, and I was searching for answers of how I make a bigger impact on both those that provide and receive care. And some of the introductions you made for me over a year and a half ago now have branched out into wonderful collaborations, and quite frankly, in many cases, lifelong friends that I've met, worked with, heard their story, they've heard mine. So I want to thank you for being one of the first people that was willing just to hear a little bit about me and where you aligned me. And I mentioned in the introduction, a connector of amazing people. And so I want to thank you for that.
Oh, you're very welcome, Geoffrey. I'm so glad to hear that again. That is my goal, and of course, what HRC seeks to do.
Yep, we're going to talk about HRC in a minute, but I'm going to get into what resonates with me about your work. And I'm going to do it in two separate words, but they're going to tie together. And I'll start off with the first word. And the first word is action. Okay. And I'll tie it back to my business which is employee engagement. And we have so much data, and we have all of these surveys with 60, 70, 80 questions, whatever. With many of the questions don't even matter, because high performing teams and low performing teams answer the same way. So we're wasting people's time. We're asking the wrong questions, because when we have that much data, we really truly have nothing actionable. And in healthcare, when I first got into this journey, I heard a lot of people pointing out the problems and, everything wrong with the system. And I got scared at first, because I'm like, I haven't heard anyone talk about solutions. I haven't heard anyone talk about action. But you take action. And that's the first thing that truly resonates with me about your work is the connecting of like-minded people, but with vast different skill sets and expertise and everything. Because whenever I hear what a person say, I have the single answer, I stop listening because there is no single answer. It needs to be all of us together figuring it out.
Yes, exactly.
So the first word is action.
Good word.
I'm going to tie the two together. And the second word is joy. Okay. And that ties a lot into this show. You know, I was on the YouTube channel of Healthcare Reinvention Collaborative, and I watched a 3-minute video that you did that I'm going to put in the comments of this show because I want people to invest 3 minutes in that, talking about moments of joy. And this show is about moments, not just big moments, but small moments. And you talk about in this 3-minute video, the complex system like healthcare. It's okay to acknowledge and identify the issues, right? The problems. But to quote you directly, you say, but we shouldn't stay there, right? And that's what brings us to action. You said we need to come together to create hope, change, and joy. Moments of hope, change, and joy. And that's a lot of what this show is. And I say it on the outro, and I hope everyone sticks through the entire episode so they can hear me say it again. But I say, you know, sometimes it's not just the big moments. It could be the small moments. So I implore people to keep your eyes open and stay authentically present, because you never know when a moment of joy is going to show up.
You know, just like with how you introduced me, how I show up to you, you hit it right on the nose with this as well. It is moving away from just discussing to action. What can we do? And, you know, with limiting or liberating structures, rather, they talk about the 15% solutions, the small things we can do. Because when we just throw up our hands and say, there's nothing I can do, well, then, yeah, there's nothing you can do. And we're not going to get anywhere. But each one of us can do something. It doesn't have to solve the big elephant of a problem, but it can contribute towards and perhaps have a ripple effect, as Todd Otten would speak to. And then I do love that you found that video on joy, because if we're not joy-filled with moments in our day, it's not going to be every moment of the day, of course, but in those moments that we can look back and say, wow, that conversation with Geoffrey, what joy. Throwing a toy with a dog, what joy. There was moments of joy in my day. I mean, what else? This world, this life is to be lived with purpose and joyful purpose.
And early on in my career, I was always focused on the big win, right? The home run, as you said, fixing this huge problem. And what I realized is that can really strip you of energy, because those big wins, those big moments don't come around. I've talked previously, you know, of little moments, and the reason why this show is named after my dog Mo. You know, the first night my wife went to sleep after losing all of her long down to her waist hair due to cancer. The first night she went to sleep bald. When she fell asleep, Mo just put his head on top of hers as if to say, I'll keep you warm. And that was a moment during a very difficult time in our life, but it filled me with joy to see someone so selfless, someone so that just wanted to be there for another person. So it's not always the big wins, because the small wins are what are going to get us through each day and continue to stay joyful.
Yeah. Well, and those small wins that we have with others have a domino effect. It might not be immediate, but they're going to reflect back on it, and it is going to make a difference. And so just trusting that those moments we have with each other do have a larger impact down the road.
I would be remiss if I didn't reference Pantha Vahidi, which I do every episode because of her brilliance. But she talks about compassion being the only thing that impacts the giver, the receiver, and the observer, as you just said, because these small moments of joy can trickle.
Yeah. Well, Geoffrey, kind of pulling all of that together, if I may.
Sure.
I have I want to turn the table on you a little bit. And you gave me a really good opening just with how you've started this, but also how you referenced Pontia just then. Because I've listened to a number of these episodes that you've done, that you've kicked off. And one, I want to celebrate what you're doing. This is, I know it's not easy. It's a lot of work. You are finding tremendous people and then doing research to ensure that these conversations are rich and highlighting them. And I want to reference a few of the conversations you've had and then show you how those individuals connect to each other. And then to, when you talk about what might be my moments, why those reflect moments for me. So the first is Pontia. I mean, what a conversation to start your episodes with, talking about compassion. And listening to her as she talks about compassion, it connects to your heart and it makes you recognize that it doesn't take a lot to be compassionate, that it's that empathy combined with action, and that action does not have to be big. That action could be putting your hand on somebody else's hand, right? That's action that's saying, I'm here, I'm with you. Pontia was just a beautiful start. And then I listened to the one that you had with Apurv and Stephanie. What I really appreciated, I heard you say that you're seeking to find the way that you can make the biggest impact for those who are providing and receiving care. So I love that what you're working to do really aligns with what I'm working to do, but also with so many that I talk with, what they're striving to do. You identified also in that time, again, and you've talked about it here, is we're really good about talking about or pointing fingers at the problems, and we're not good about identifying where it's currently being done right or lifting a hand towards a solution to what those problems might mean. And I don't remember if it was you or Perv, but one of you said the tsunami of negativity. And I thought that was just brilliant. Yeah, so much
That was
of that.
a Perv that said that.
Was it? Yeah.
Yeah.
And you see that on LinkedIn. That's what's getting the reactions, is the tsunami of negativity. And how do we help to shift that tide? And then Sally Wolf. Oh, I love that you talked with Sally. She is a delight. And when she said that in her intro of herself that she leaves a trail of glitter, that conversation, metaphorically, there was glitter all over the place. It was a delight. And I noticed that you had to perhaps restart because the conversation was so rich. You kind of had a little hiccup in time. And I think it's because you scheduled a block of time and you needed more, because it's
we had some technical difficulties with an internet connection.
Okay.
The internet went down in New York City for a moment.
Okay. I just assumed it's so rich we've run out of time, and we're gonna, like Zoom kicks you off if you have a free account.
Yeah. No, and by the way, I always have an outline for the amount of time I like to have the show for, because I know for me, when I watch podcasts, it's like if it's past a certain point, I'm like, okay, that's a big investment in my time. But with Sally, there was no way I was cutting that off.
No, it was so good. Yeah, and you guys could have kept going. I love that she referenced the no one's just a. When I worked with Studa Group, Rich Blooney used to do a keynote, and he probably still does, but he talks about there's no such thing as just a. You're not just a housekeeper or a food service. You are a vital component of the overall system of care to each and every patient.
And I found it fascinating that she had a singing janitor. My wife had a singing food service person. The absolute synergy in that was tremendous.
Yeah. Well, and my background in healthcare was as a registered dietitian, and I worked food service for many years. So yeah, I have a passion for our support services teams. You also, both of you spoke about people first leaders, and that really connected back to something that Stephanie said in the conversation with Apurv, where she was talking about love, compassion, and empathy are free, right? But they contribute to the bottom line of our organizations. But why is that not where we're putting our time and energy? And that people first leaders, they lead with love, compassion, and empathy.
And I find it fascinating that, the podcast network, that loved this idea and wanted to help me bring it to life is called the People First Network. That's my podcast network that behind the scenes does a lot of my help.
Yeah. And I love that they're putting that up. This is who we are, right? I think that's fabulous. And then the other one I wanted to reference was Claudia Kamita. She is amazing. I love her story. And she's talking about the system being overly complicated. And especially with technology that we think is going to simplify, it really hasn't. It's overcomplicated for those within, and it's really overcomplicated it for patients trying to navigate this system. And she said what we need is humanistic simplicity. And then she identified that free clinic that she had attended, that because of the nature of who they are, they're able to decomplicate the system. And those caregivers, because they're donating their time, but they're feeling such joy and connectedness to their purpose because of the structure of that system. And what we could do if we could uncomplicate some of this nature of healthcare we've created. And so those were just a few things. I wanted to tell you how it kind of weaved in, though, for me. So that patients are both on the side of receiving care and on the side of being a part of the care team. So Stephanie spoke about that when she talked about her daughter who was born 3 months early and was in the NICU. And when the nurses couldn't figure out, why has the status of her daughter's care changed, Stephanie was able to say, well, she hasn't had caffeine since Friday. And they hadn't recognized that. But Stephanie was integral in that identification. Patients are part of the care. They are not just on the side of care. And Claudia says that as well, right? That's why she got into the work she's doing when she needed to navigate the care for her father, the complicated care. And she saw what was going on in the hospital, and she was integral to ensuring that his care flowed well and that the dots were connected and he got what he needed. And so that was one of those things, but it elevated in two different conversations. The other thing that elevated in your conversation with Sally and in your conversation with Claudia was, and you identified it for yourself as well, it's that trying to run a business as a solopreneur. This isn't what we didn't step into our career saying, I want to do that all on my own. We did it because we have a passion to make a difference. But that passion, what we want to do, is complicated by all of the other elements of solopreneurship. And how do we find our network, our people, and help to ease the way? And so you talked about it. Apurv and Stephanie talked about the need to connect these individuals that they're raising in their podcasts and having that loving ecosystem to be connected within, which is what HRC seeks to do, to help identify those of you who are out there innovating, trying to make a difference. How do we identify, as I, in one or two conversations with you, as, you need to meet so-and-so and so-and-so. How do we connect the dots so that you're not alone and those people that you need in your network are found and you can start some collaborations? So I think the last thing I wanted to identify, Claudia had talked about that fancy isn't necessary in our hospitals. At the end of the day, people just want to know you care. And this really resonated with me because I just seen somebody posted about the recent conference for health and how ritzy and glamorous it was. And she said, I just wanted to meet the people and do the work to make those connections. That's what HRC talks about. We don't need the glitz and glamour. We need authenticity and connection, right? And so those are the things that what I wanted to identify is in those few conversations you've had and I've listened to, there's richness in what has been collected just a few episodes in. And the connections that I can carry across those conversations, and I hope that they're seeing in each other and that all of those individuals you've met, I hope they each have met each other, right? That they're seeing those connections. And then how do we pull it together so those people who are doing fabulous things that are connected. I can see the connectedness. How do we pull that together? How do we help them to see each other and know when to come together around aligned efforts and help to support and amplify what each are doing individually?
And you mentioned that connectedness. I always like to say in my business of employee engagement, people just want to feel seen, heard, and valued. And as a patient, they just want to feel seen, heard, and cared for. It is really that simple. When I talk about the secret sauce about employee engagement, it's not hard. It's simple. And when we break it down to the simplest forms is when we make true transformational change.
Yeah, I agree, Geoffrey. And off of that, the challenge that happens is those leaders who are put in the position of we want them to be the people-focused leaders. Their plates are overfull with non-people-focused tasks. And that is what the dashboard reflects as their priority. And so you identify, or Stephanie did in her conversation with you as well, that when we lead with love, compassion, and empathy, the other will follow. But that's not what we're reflecting to leaders. That's not what they're asked about. They're asked about typically, what tactic are you putting in place to meet that objective? And so they are overpressured instead of their plates being simplified so they can focus where it really needs to focus.
Yeah, and it's amazing just the human side of it, how, because a lot of my business is steeped in evidence-based science and research, but executed based on human connection. Mm-hmm. And it's amazing how when you do things more human, how the HCAPs come along, how another person you introduced me to is Stephen Beeson. We talk a lot about how I know the answers to the test. If you're a physician or a nurse that's investing in your own professional development, you're investing your time and your energy in that, I know you're more engaged in your work. So I know there's going to be a proof point that healthcare administrator does care about, that is going to come along, that we're going to have better patient satisfaction scores if their physician is investing in compassion training in small increments. Like, we know the answers to the test. If we're more human, the metrics they care about will follow. It's why Panta says, I can't believe I have to build a business case for compassion. I say, don't worry about it. I'll do it. Because I already know the answers to the test. Because the people inside that organization, the metrics those people believe in, that they're tasked with, and they say, get this number right. I can point it out. It's why I talk about bottom-up versus top-down engagement. Because if I can do it in bite-sized pieces and say, look at where the pockets of brilliance are. Look at where the teams are 5 out of 5 all engaged. I can then tie that to a metric. But if I look at it organizationally, top-down, as a big picture number, there's nothing to take action on. But coming back to the original thing is taking action. If we have an organizational metric, there is no action. But if we have a team metric where I can say this team, it just feels different on this floor, I can tie it to the metrics they care about.
Wonderful.
So, name of the show is Mo-ments of Experience. So I'd like to hear your moment, the moment or moments that moved you, that shaped you, that inspired you to pursue a purposeful journey.
Well, and that's in part why I shared what I was getting from your podcast, because it's those moments. It's that, so what I'm doing at this time is seeking to identify, connect, support, and illuminate those individuals or small groups who are passionately working towards changing healthcare for the better. I got there to what I'm doing now because of conversations with individuals such as yourself, Geoffrey. I have met hundreds of people in the last few years and heard similar stories over and over again of either falling out of healthcare purposely or pushed or affected by healthcare on the patient side and seeing that they could do something about. It's those moments of seeing individuals who are so purposeful and willing to put their everything on the line to push that purpose forward that are my everyday moments. It's those little moments of seeing that inspires me to figure out how do we help to connect so that we're not all we're like little gnats going at this big elephant of a problem, but we're not going to get anywhere if we're individual gnats. If we can swarm together, doesn't mean that we're all doing the same thing, but we're aware of each other and we're collaborating around the root causes that's resulting in what we're each passionate about. So we huddle around when we need to and collectively work on solutions. Then together we can climb this big mountain and get this done. And so that's what I'm seeking to do. But it's these moments, it's these individuals who are as passionate as I am about the change we need to see in healthcare that keep me going and have really fueled me to where I am today. There are other moments that have gotten me to various aspects of my life, but that's really what I'm centering on right now. It's individuals, Geoffrey, such as yourself, Sally, Claudia, what Apurv and Stephanie are doing, and so many more. Those are the moments.
And you talk about, the people that are brave enough to kind of jump without a net and just try to make change. This podcast came about on the 1-year anniversary of me leaving the corporate world, because there was a moment for me of fear. It was, what did I do? This is hard. And I thought back to all the amazing people I've met, starting with you. You put me to Apurv and Steve Beeson, and Steve Beeson sending me to this person, and it just branching out. And I said, because there was a moment that I said, what did I just do the last year? And it came to me that that last year was about now telling all of those stories so that you could have moments of hearing these other people that have bravely tried to impact a system that is very hard to impact. And, as I said to Apurv, Stephanie, they were the first ones I found that were talking about positives. When I left the corporate world and was like, what did I do? But yeah, that's why the show exists, is because I wanted to tell those moments to inspire others to realize that there are, you mentioned Claudia Cometto. When I originally introduced myself to her, she made a LinkedIn post that she said, I'm looking for the others. I'm looking for the others that are chasing change in healthcare. I'm looking for the others that are trying to make a purposeful impact. And I just sent her a LinkedIn note and said, I'm one of the others. And that's where our friendship started.
Nice. Yeah. Well, and that's, there are so many who I've met on LinkedIn who are positive. And those are the individuals that I initially reached out when I was saying, okay, how do we move these conversations to action? And that's what, that was over a year ago, probably about the same time that you were stepping into what you're doing. And it was, how do we come together and do something different? And through that exploration, this is where we're at now as we're taking off with HRC.
Yeah. Do you want to talk about Healthcare Reinvention Collaborative and just give because I where there's going to be a link to the website in the comments and the show notes. So please check it out. I am a part of it as well. It's a lot of like-minded people, but as I said earlier, like-minded people with vastly different skill sets and backgrounds, all working together to tackle this.
Yeah. Purposely seeking a diverse set of individuals, right? Yeah. So Healthcare Reinvention Collaborative, I had reached out to 20 different people who I had met on LinkedIn, had really rich conversations with, and said, would you come together with me, a big group, and let's just talk about what's going on in healthcare and how can we start moving towards action? So I created it was a workshop. It was a 2-hour event where they got to know each other because they didn't all know each other. And then we had these breakouts with really rich conversations. And I said after that, this was great. Would you do it again? And 9 people came, and 9 people came back to the second and third time we did that. And then on that last one, I said, here's what I'm thinking. I think we need to find a way to connect individuals such as yourselves and others so that we can see and our actions can be collectively put together to collaborate. And a few people said, okay, so you're talking about building a business? I'll go there with you for further conversations. And so from that, we've added others, people have left us. That's the whole idea of HRC, is that we'll be very fluid. But fundamentally, we are seeking, as I said, we're using what's called the 2 loops model, and we're seeking to identify those who are falling out of healthcare or otherwise identifying they are purpose-driven to improve the current structure of healthcare. Well, to reinvent healthcare. So elements of current will retain, but not all of them. We are then seeking to connect them. So we're creating a social network map so that people can find each other and see how they're connected and learn more and more easily identify or reach out even to be able to say, I want to. Anybody interested? And they can find each other and collaborate. We also then want to support individuals. So how do we help them with some of the skills they may not have? And HRC isn't necessarily going to give them the access to the skills, but within our network, we're going to have people who have those skills. So we can draw on others and make those connections. And then we want to illuminate. When people are doing things that are good, Geoffrey, this is what we need to illuminate, these types of conversations you're having. And so many other that's good, that we illuminate the good. And as people are starting to find each other and connect and create within the tools and resources and connections we're able to make to them and test new elements of the system that will be reinvented, we'll illuminate that so that others know, oh, we can go over now. There's a solution that works. We can stop trying to uphold the solution does not work and move towards the one that does. And so HRC, we're really, we call ourselves the connectors and conveners of people. HRC is not going to reinvent healthcare. We're going to enable those who are purpose-driven to create the healthcare system, the wellness system that we need. We're going to enable them to do so.
Yeah, and I know numerous times through those meetings and through those collaborative conversations where we just get to meet new people and have it's kind of like a speed dating
It is.
thing. And I've had so many people reach out to me after that and say, hey, I heard the 1.5-minute version of what you're doing, but I heard you say you support nursing clinician entrepreneurs of help taking their great ideas to build them into a business. And can I tell you what I'm going through right now? And because all these people are purpose-driven, everyone is so generous with their time, and to have those exploratory conversations of how can I support you or how can you support me? And that's the beauty of it.
Mm-hmm.
So that is great. I implore everyone to look up Healthcare Reinvention Collaborative. As I said, I will put that obviously in the show notes. Is there anything you'd like to add before we wrap up? Because I truly appreciate your time. I appreciate very much, as I said, your action, your joy, and your willingness to collaborate and work together to connect great people. I appreciate it so much. And you are an integral part of the beginning of my journey, and you have remained a part of it through the stage I'm at now, and will remain a part of it until I find the place that I can make the biggest impact.
Yeah, Geoffrey, it's been a true delight to connect with you and to see what you're doing with others through those connections, and just celebrating everything that you're doing. And yes, I also look forward to that further collaborative that we'll probably find as our paths continue to weave together.
Thank you so much for your time. I appreciate it. And it's been great.
Thank you, Geoffrey.
Thank you for joining us on Moments of Experience. I hope today's conversation touched your heart and inspired you to reflect on the impactful moments in your own life. Remember, it's the seemingly small moments that often hold the most significant power to shape our lives and the lives of those around us. So keep your eyes open and do your best to be authentically present. If you enjoyed today's episode, please consider subscribing, leaving a review, or sharing it with someone who might benefit from our discussions. Until next time, I'm Geoffrey Smith, reminding you to cherish the moments that bring hope, connection, and purpose to your journey.